Professor of Medicine and Infectious Diseases at the Mater Hospital and the UCD School of Medicine. Dr. Jack Lambert, good morning to you.
Good morning.
What is your take, Jack? And there's much toing and froing back and forth on green lists and people going on holidays and whether it's safe to do so, and people like me who are saying absolutely no way, I've cancelled it, goodbye, good luck, we're not going as we were supposed to be in the next couple of weeks. How do you feel as an expert in this field about people leaving the country right now and going to other countries having a holiday?
Well, I just think there's so many polarized opinions, on this subject right now, and I think moving forward, the new norm is COVID's going to be around for a long time, and COVID continues to circulate in low numbers in Ireland, and we saw that just there's been new cases, mostly local cases, just in the last month in Ireland, and focusing, saying that nobody can travel, nobody can go anywhere because they'll bring COVID back into the country is I think is missing part of the point here. So yes, I don't think we should be doing unnecessary travel, but then what is necessary travel, what is unnecessary travel, what is safe travel, what is not safe travel? And I've said that, absolutely. I wouldn't go to, so this message was Portugal's in the surge. I think it's a bad idea, but Spain is stable. Places like Iceland is stable, places like Slovenia is stable, places like Greece is stable, and there's probably more of a risk of Irish people bringing it in some ways to some of these countries, unbeknown, than bringing it back from some of these countries. So I think we need to individualize, and yes, we do need to come up with lists, and we do need to be hugely cautious, but we have to not just keep on saying, we're going to, freeze things. We need to move forward with best practice on what we know, and face masks is a critical part of that all over the world, and in the city, and safe travel is a part of that as well.
To unbox that a little bit, if I can, the idea that you can go to Spain. So let's say that people, and right now they're in the airport, they're getting ready to go on flights, they've heard the government guidelines and they've heard what Ronan Glynn has had to say, and they go, actually, you know what, I'm going on holidays anyway, and I've made a risk assessment and I feel that this is safe. What can happen, Jack, and I know this has happened to people that I know, is that you go and it's fantastic and everything is great and there's no risk, and then all of a sudden there might be a small increase in cases or a surge in cases in a country, and all of a sudden that country is deemed to be more at risk while you're there, and then you're in a very different landscape.
Right, but you are and you're not. It's no different than being in Dublin. So you go to the pubs in Dublin, and there's a surge in Dublin. You're in Ireland. So what do? If you meticulously take care of things, hand hygiene, social distancing when possible, and using face masks, you won't catch the virus. That's the message when we worked in the hospital. That's the message in Dublin. So let's say there was an outbreak in Spain. I'm not suggesting that if people are going to Spain, for example, say you're going on a summer holiday because you've got family members there and you want to go out and meet them for all sorts of, you've made that decision. If you meticulously follow the same precautions in Spain as you would in Ireland, you're not going to get the virus. So I just think there's a personal responsibility here, and yeah. I agree with not traveling unnecessarily, but I just think we actually have to individualize and not put a ban on travel forever and ever and ever.
Which brings me to my next point, and you've used the word meticulously there, and I consider myself to be quite meticulous. I know you are, because it's your job. Not everybody is meticulous. Everybody, and we talked about this on Monday, everybody's risk register is different. Some people will stick to the rules rigidly. Others will have a very laissez-faire approach. Some won't do anything different to what they've been doing all along. I don't care about the meticulous ones. They're great. They're probably not going to go anyway because they deem it too risky. It's the ones who don't have the same kind of care or respect for what they need to do that I'm worried about. I passed a bus this morning, half the people were wearing masks, even though it's mandatory to wear masks on buses.
But why has it taken 2 months? We've known that masks are the critical component here. If we just get the message out there, so why are we so concerned about people bringing the virus in? Because everybody on that bus putting other people at risk by not wearing a mask. And 98% of the cases in the last month in Ireland have been local cases. So we really should focus on where the problem is. So I don't care if you use a mask on the Dublin bus or you use a mask in the Amsterdam bus if you choose to go to Amsterdam. If you use meticulous care, you won't get the virus, and making arbitrary decisions to people that you can't travel here, you can't travel there. They are traveling. I just think that, and I think they should limit the travel, but I think the message really should be 100% compliance with safe practices. Even coming back into Dublin, I saw Twitter the other day, many of the Dublin DAA staff are not social distancing and wearing masks. And the message was, we'll encourage them to use masks. You don't encourage people to use masks. You tell them, 100% this is a safe thing to do, and do that to waiters in the city centre, do that to the Dublin DAA staff, do that to personal individuals who stay in Ireland, who travel outside of Ireland. I think that's the best strategy moving forward, rather than coming up with polarised, you shouldn't do this, you shouldn't do this. I think we need to give clear guidelines moving forward, because this is a new normal. And I think we should be conservative, but we actually have to move forward in some reasonable way. Okay. Financially, psychologically, and medically, you have to come up with a safe strategy.
This is Jonathan Healy filling in for Pat Kenny this morning. I'm speaking with Dr. Jack Lambert, who is a professor of medicine and infectious diseases at the Mater Hospital. We have a poll running on Twitter this morning. Jack, the question we're asking is, would you tell your friends and family not to visit you when they return from a holiday abroad? And the reason we're asking that is to just try and gauge how comfortable people are with those who are leaving the country right now, whether it be to a country where you're allowed in or a country where you're probably not recommended to go. The answer is yes. 78.5% would tell friends and family not to come near them for the requisite 14-day period on their return. There is a discomfort around this, and I don't know if that discomfort will be resolved by anything other than a vaccine, which brings us back to this being a long-term problem.
The vaccine is the face mask at the present time. This is a long-term problem. We don't have a vaccine. I hope we will, but it's 12 to 18 months, maybe never. So what do we do in the meantime? And I think in the meantime, face masks are the critical prevention moving forward on top of everything else. And public opinion shouldn't decide science. I mean, we're doing polls 2 weeks ago. Are people going to use face masks? Do we think it's, getting polls from the community on, would they be okay with using a face mask? I think if you just put a sign up, use a face mask. I think the Irish population is very compliant. They were compliant with the lockdown. Give instructions. You have to wear a face mask. You don't need to legislate it. People will follow it.
One of the things that I'm personally struggling with is the constant wait at around 5:30 every evening for the number of cases. And I'm not as qualified as you are by any stretch, but thankfully the number of deaths have reduced significantly. We're seeing there was 2 consecutive days at 0. There was 1 death tragically reported yesterday, and then there was 4 cases on Sunday, and then there was 24 cases on Monday, 24 yesterday. I'm going, oh my God, this is happening again. People are losing the run of themselves. Do we need to contextualise those numbers a little bit better, Jack? Because where we see weekly rises are probably the most important thing. Numbers of admissions to hospital are key. What is the acceptable number of new cases when this is apparently endemic in the country? It is there now and won't be eradicated, which I think is what most people want it to be.
Right. Well, I think if you're seeing cases like this, it's a failure in the system somewhere. And we're going to have failures. Look at some of the best countries. Australia just had an outbreak in Melbourne. Israel just had an outbreak. They have, their numbers are 10 times better than Ireland's, and they're still having problems. I think we have to face the fact there's going to be outbreaks. But still, if we have 24, that means somebody wasn't wearing a face mask. That means a server wasn't wearing a face mask. That means there was a breach in the system. So I think we just have to educate people on not polarize them and say, nobody can go travel because you're going to bring back COVID from Iceland. I think the Icelandic people are more at risk of catching COVID from the Irish than vice versa. I think we actually just have to teach people on why it's important to use a face mask, why it's important.
But Jack, I can tell you now, because the screen will light up in a minute with people going, it is my right not to wear a face mask. It is an infringement of what I am as a human being. Now, they're in the minority, but there is an element of that running throughout society. Otherwise, everyone would be wearing face masks. I did the shopping last Friday, and I was the only one wearing the face mask in the supermarket for most of the journey. I saw a second bloke. Yeah. So, I mean, the message isn't getting through. So therefore, you talk about trust, you talk about meticulous enforcement of the rules. If we can, the people are not buying into this, and if they're not buying into this, then we're going to see those numbers creep up, and we're going to be back in trouble again. So who does it? Who pulls the trigger on compulsory face masks, and how do we enforce that? Because that's a tricky job.
But I think we've not. For the last month, we've been going back and forth on face masks. We recommend it, we do this, we do that. I think public messages on the television, on the radio, from the government with very clear messages will make a difference. In Spain, they legislated everybody has to wear a face mask. That's the way they did it, okay? I'm not sure that's necessary here. I don't think we've given clear messages until really recently. Just in the last couple of days, there's signs up in the buses now. Great, wear a face mask going on the bus.
But they're not wearing them. They're not wearing them on the buses. As I said, there was people on the bus this morning not wearing them.
Okay, then I'll have to take a look at that. But because I haven't, so that's a step in the right direction. But yes, then if that doesn't happen, then we do need to legislate it. But I don't think we have to. I actually think Ireland's done great in terms of the lockdown. People were very compliant with it. I think if you explain to people the reason for the face mask, they'll do it. Just like you don't tell people, if you're going to jump out of an airplane, use a parachute, okay? Yeah, it's common sense. You don't need to legislate it. People will do it, as a rule. I just think you don't need to legislate certain things. I would continue to do education on the part of the Irish public in terms of the critical importance of face masks as a first step, and then the next step obviously would be legislation.
Lots of texts coming in. One listener says people can download the COVID app all they want to talk about how great and helpful they are. Then they sit in the bus or walk into a shop without a mask or a care in the world. Until you make the wearing of face masks mandatory, we're fighting a losing battle, says Chris. I'm blue in the face saying that this is wrong. What is wrong with the government that they won't do it? Can you ask Dr. Lambert, says another texter, why did healthcare workers get COVID if they were meticulously adhering to guidelines as they should be? Was that a PPE issue, do you think, Jack?
Well, no. The issue was in the first month of the doctors and the nurses being in the hospital, we were told not to wear face masks. We were told not to wear face masks in common areas. It wasn't necessary. There was no evidence the virus transmitted. This was the message coming out from the WHO and everybody else. I was wearing a face mask, and we were ostracized for using face masks in non-patient situations. And so that's the reason. During that time period, lots of healthcare workers became infected. As soon as healthcare workers started using face masks in non-patient situations, in common areas and coffee areas, it was eliminated. I've mentioned this time and time again for the last 2 months. It's when you see it in front of you. We had lots of staff out when they weren't wearing face masks. When we started meticulously using face masks, there were 0 staff out. This is the same message for the community.
We talk about the Irish people a lot, and you're right, they've done tremendous things, and again, we've seen that in the last 24 hours at least. Okay, they mightn't wear masks, but they've downloaded the app, and hey, that's at least something. What about those coming in from other countries? Because we know now that the number of flights coming in from the US has increased, and while an Irish person can't go to America right now, there's no prohibition on American coming to Ireland. Yes, they have to fill in a form saying where they're going to stay, and they're being told, would you mind awfully quarantining during your holiday? But the rules and attitudes in that country are different to how they are here. So in that context, is there a risk of spread of the illness with people coming in who may not be as meticulous as the Irish, or who might not understand as well as we do or how this virus spreads because their country is different?
As long as we make these things voluntary, I think we're going to actually come up with reasonable guidelines. So if I was personally making the decision, I would actually request that all Americans coming in, have the self-quarantine for 14 days and meticulously use face masks and all the rest of the precautions that they would use, during a time that they travel within Ireland. But if I had somebody coming in from Iceland, like I said, where there is no COVID, I would actually tell them to wear a face mask for their own protection, but not go through quarantine. So
how do you enforce that, though, Jack? I mean, that's the key question. How do you enforce it? You can't.
You can't enforce it, but you can educate. That's the best you can do, and expect. And I would hope that the people who would be traveling from America would be the responsible ones, not the irresponsible ones. And that they would be even better in terms of preventing spread to the Irish population than it appears like some of the Irish are just now by not wearing face masks on buses. So I just think there is no easy answer to this. What we're trying to do is live with COVID. We can't eliminate COVID. We can minimize COVID, but we need to go on with our lives. And because it's having impacts. And then every month we delay, I mean, I've mentioned this before, what's the end game? How long are we going to do this for? Forever? Until a vaccine comes along? What if there never is a vaccine? Which is a possibility. We need to get on in a safe way for psychological, medical and financial reasons. There is no easy solution here. We need to come up with, need to make decisions, not just sit back and watch what everybody else is doing and delay decisions month after month after month.
Can I ask you, the WHO's advice, and you've referenced it before, it changes, obviously, as we learn more about the virus, because it is new and science is catching up. It will eventually get ahead of it, but right now it's still in the catch-up phase. The WHO is now indicating that the method of transmission is probably a little bit different. So in other words, aerosol, that it hangs around in the air, that the droplets are really, really small. Now, a lot of people have subscribed to this already. Is that more worrying, Jack? Because I know that's probably the worst kind of viral transfer, is that something can hang around in an enclosed space and you can pick it up longer than we would have thought before now. Does that worry you? And is that going to result in a change in guidelines at some stage in the future, do you think?
Well, but there's no change necessary. There's no change necessary. The guidance is you need a mask. A mask will prevent that. If you're in an enclosed space 6 feet away from somebody and it's aerosolized, then it's going to jump. The virus is going to jump 7 feet or 8 feet. So social distancing isn't going to work. A mask will work. It's that simple. This is getting back to the critical thing. But we have actually known this. There was a textbook from 15 years ago on coronaviruses, as on SARS, which is a virus similar to COVID-19, and there was cases of what they called hypertransmitters, people who transmitted without any symptoms, and they transmitted 10 different people. We know that. This has been reported with COVID as well. So it's been very clear that this virus is, it's a new virus. We're using data from other viruses to say, oh, this one's going to be like this. It's new. I think we don't have to wait for the WHO to say, oh, this virus is more transmissible. 6 feet isn't good enough. 2 meters isn't good enough. You need longer distances. I would say if I was moving forward in the next 6 months, I would say in a bus, put the bus at 2/3 capacity and have 100% people wearing masks. For short trips, that's probably a practical way forward, rather than kind of saying, oh, you have to have 2 meter distance, only 20% of the bus full, and people have the option of wearing a mask or not. Yeah. This is just a bad logical decision on my part, and we don't wait for the WHO.
All right. What about restaurants and pubs? Those that reopened this weekend, right? And there was a big brouhaha about 2 meters versus 1.5 meters, etc., etc. You can't wear a mask, as a texter is making the point here. You can't wear a mask if you're eating or drinking. So therefore, are pubs and restaurants doomed to close again?
Not necessarily. I think if 100% of all the servers are wearing masks themselves, and I think if we use 1 meter, we use masks when we're not eating and drinking, and we minimize the time in these restaurants. Yes, it's an experiment. Will it fail? It'll fail if people aren't wearing masks and all of the servers are running around with no masks on, which they are in some locations in Dublin at the present time. I think we actually have to, don't fight over 1 versus 2 meters. I think we actually have to put together the whole plan, and that's making sure there's masks, making sure there's hand washing facilities, and making sure there's a safe distance and short periods of time in those locations, and we'll see what happens. That's the only solution.
Dr. Jack Lambert, Professor of Medicine and Infectious Diseases at the Mater Hospital and at the UCD School of Medicine, thank you for your thoughts this morning, Jack. Well, listeners, what do you make